I think an important message for people with migraine is to not ignore your migraine. First of all, educate yourself, learn about migraine.
Over 2.7 million Canadians suffer from migraine, a neurological disease. Today, we meet with Dr. Werner Becker to learn more, because when it comes to reducing the suffering from migraine, knowledge is power.
Migraine is a neurological disorder that causes recurrent attacks of headache. Migraine headaches are really more than a headache. They often have associated symptoms like light and sound sensitivity. They often have nausea. Some patients will even vomit during attacks. Some patients, of course, have an aura as well, perhaps some numbness along with their headache attacks. So migraine can be quite disabling. Migraine attacks can really interfere with a person's quality of life. Certainly, most migraine attacks makes it difficult for people to carry on their usual activities like work or leisure activities during an attack.
Migraine can certainly impact families. Amber has been struggling with the pain of migraine since her teens.
As a busy mother, wife, working woman, it is so difficult to deal with a migraine on top of traveling and getting on an airplane and, trying to get everything organized before I leave my family is excruciating.
Although migraine is not curable, episodes can usually be managed with medication and non-medicative therapies, including lifestyle adjustments.
There are two classes of medications. The first type are medications used to treat the individual migraine attack. We call these acute medications, and the mainstays there are the non-steroidal anti-inflammatory drugs and the triptans, which are another class of medication. One can also combine the two to get added benefit. The second class of medications are preventative medications. Now, not all migraine sufferers need those, only those who have fairly frequent attacks. One problem we have in treating migraine is that if migraine attacks are frequent, patients may take the medications to treat individual attacks too often. For most of these medications, if you take them more than 10 days a month, then you get more and more migraine over time. We call that medication overuse headache, and it's a big problem.
Beyond medication, migraine patients are actively involved in treatment through lifestyle adjustments, reducing stress and other triggers.
Now, if you want to make yourself less migraine prone, you have to develop a migraine-friendly lifestyle. And that involves things that are really pretty simple but often neglected. For example, people with a migraine should not skip meals. They also should maintain regular hours with adequate sleep and regular sleep. They should maintain good hydration. They should watch for migraine triggers and manage those. There are many things like that which you can work on, and one of them is actually caffeine. Too much caffeine, in the same way that too many painkillers do, can make migraine worse over time.
Patient involvement is key, but some patients prefer non-medicative options when possible.
First of all, it's been shown that taking magnesium supplements can reduce migraine frequency, and so can taking vitamin B2. And finally, we're getting more and more nerve stimulation devices or electronic devices like Cephally that can be used to stimulate some of the nerves, for example, in the face. And this also can have an effect upon reducing migraine attacks.
I still take medications as part of my therapy for migraines. I have found in the last 5 years or so that it is starting to work less frequently and my migraines are getting more severe. So having Cephally as an option is such a life changer. I can use it as many times as I want. So I love having that as a benefit to just even take away the pain for a minute, an hour, 10 minutes, So I love having that as an option.
A number of treatment options, some very new, are now available to treat migraine.
The good news for migraine sufferers is that a lot of research is being done on migraine. We're gradually understanding migraine better, and the better we understand migraine, the better treatments we can produce. In addition to the oral medications, we have the Botox injections, and we also have the new CGRP antagonists. And I'm sure that more new things will come along as well in the next few years as our understanding of migraine deepens.
To learn more about migraine, please speak with your healthcare professional or visit migrainecanada.org.